Hello and welcome into another episode of Gifted Kid, Messy Adult, a Neurodiversity podcast, the show where potential went to die. I'm one of your hosts, Ellie Michaels. I use she, her,
I am your host, Jessica Michaels. I use she, they.
and today is a very special interview episode with, uh, who are we interviewing, babe?
We are interviewing our very good friend, Cameron Little. Now, Cameron Little is sometimes a stand-up comedian, occasionally a writer, and a few times has been accused of being an improviser and is often confused about what they were about to do when walking into a room. So I think a perfect fit for our show. So welcome, Cameron Little.
Hello, hello.
Hi! And today we are going to talk about our experiences with ADHD meds because that's something that I very frequently get asked about from clients. And when I do speaking engagements, there's always somebody asking about ADHD meds. So I figure we'll get this whole crew together and chat about our varying experiences. But first, Cameron, would you mind telling us a little bit about yourself and kind of what your experiences are with the gifted kid, messy adult idea?
Yeah, so I guess growing up, I was what you would call a gifted kid, kind of the everything kind of came easy schoolwork wise. It was just like the good testing scores when you were little, schoolwork's really easy. And then somewhere around the teenage years when things become slightly difficult and you can't just kind of glide off of just being like, yeah, no, I don't need to pay attention to this at all. All of the things start building from gifted kid into messy kid with some gifts, and then gifted kid who lost where the gifts went and's not sure and doesn't really care where the gifts are anymore, and then an adult going, "Who needs gifts? I don't care anymore." And then that became a lot of weird, bad, stupid choices with school and flying into my late 20s. I finally got into a good therapist who said, "Hey, you are so severely ADHD, it's almost insane. You need help." And I was like, "Really? Are you sure about that?" And they were 100% right. And that's where I've landed myself as a slightly less messy, somewhat more organized, kind of gifted adult.
It, that's why you have to send the thank you notes. Otherwise, the universe stops giving you the gifts. But we're like, I'm a teenager. I don't need thank you notes.
I didn't ask for these.
What is
Yeah,
this, a gift card? You my uncle?
I think that's a story that resonates with a huge, huge portion of our audience and is the reason that we started this podcast because, we tend to put moral judgments on all of those things that are difficult. And so we spiral because it's, oh, we fooled everybody. We're not that smart. We're really lazy and stupid. And, we should be able to, I should be able to get a career going because I could, of course, been the president of the United States. And, it's just this awful shame spiral that is often stopped weirdly by an ADHD diagnosis or an autism diagnosis in a huge part of our population. So, yeah. So Cameron, I'll start. When did you get diagnosed? So it was later in life. Was it like 5 years ago, 10 years ago, 10
Uh,
minutes ago?
it would have been like about 6 years ago now. So it was when I was 29. I
Hmm.
was seeing a therapist because I had just recently become sober because I quit drinking alcohol and doing drugs for a bit and was just like, I need to talk to somebody just about this because like a self wasn't really working for me. And as I started like kind of just describing some of the issues I've dealt with and like how, addiction was kind of helping me self-medicate with those things, the more I described them to my therapist, the more she was like, "Have you ever been tested for ADHD or autism or anything like that?" And I'm like, "No, my brother has it, my dad has it, but I don't have it." And she was like, "Are you sure about that? Because there's different ways it can manifest in people, and a lot of the things that you're explaining to me feels like your, depression and anxiety issues stem a lot from these symptoms you're feeling from something that could probably be ADHD." And then we went through some of the testing, and I gave her back the answers to one of the tests, and she was like, "This is actually so high that I need you to knock a couple of these answers down because they will tell me you're lying to get medication." And I'm like, so please score lower so you can see first. Yeah, and then once I got that, it was kind of just like an eye-opening thing of, oh, I wasn't lazy and not I wasn't choosing to not pursue these things. I literally like my brain chemistry was forcing me to do something else or go elsewhere and to try and find something. Like I always joked it was the brain juice. I need my sweet, sweet brain juice to stay interested in a thing or stay, engaged in something. And I found it with like drugs and alcohol instead of a job. you know, paying attention in conversations with people I could barely stand. So yeah, it was definitely like an eye-opening late life diagnosis that was just like, holy crap, this is an answer to something I didn't even know I was questioning.
Mm-hmm. Mm-hmm.
Just when we
Mm-hmm.
thought we were done being gifted kids, once more, could
Mhm.
you score lower? You're screwing up the curve for everybody else.
Yeah, it was definitely just like, but I you told me to do my best, and I did.
Yeah, it turns out when people say that, they don't mean literally 100% of all of the effort you could possibly put into something, even if it kills you.
It's strange.
Baffling.
Neurotypicals.
So I know that I went a couple of years after my diagnosis before I started on medication. And Ellie, you did too, correct? Like it was a long
Um,
time else before you got on meds.
yeah, yeah.
Okay. All right. Yeah. So did you start on medication right away or did you go without for a while?
I started probably about 9 months or so, or maybe a year after diagnosis. It was some like behavioral things to put in place to try and make sure, okay, can I manage this on my own? I had talked to some friends who had been on a variety of different medications. Some feedback was real negative. Some was like, I don't like the way it makes me feel. It makes my brain feel different. I don't feel like myself. Some friends had said, I feel kind of like a zombie on this stuff. So I was hesitant and admittedly had recreationally used some of the stuff as a younger person. So it was like some things I'm like, oh, that's just speed. That's just like stay up and drink stuff. So I was kind of hesitant at first, but I got onto originally Vyvanse back in 2020. It was a pretty high dose. I think it was like almost 30 milligrams or 35 milligrams, something like that. It was like a pretty decently um, high dose. And I was on it for about a month, but one thing that really kept me from staying on it was so expensive back then because Vyvanse was still the only brand of its chemical kind back then. So it was like $370 for a month, which was
Yeah.
like that's basically at that time like that's my rent almost. Like I live in a crap
Hmm.
almost my rent, so I can't do that. But there was also like getting used to taking something on a daily basis that was almost helping to rewire how my brain was working or helping, you know, change how I process things or engage with things scared me. Like there was a moment where I was like, I feel almost like I'm not getting engaged in things anymore because I'm not getting that same, jolt from doing stuff that I would normally do. So I was like, am I even enjoying things anymore? Am I even able to process things the same way? I'm not, my brain's not, writing jokes or writing things the same way. I'm processing things differently. So it was very scary at first. And I told my girlfriend like I almost felt like I wasn't me for a bit, and it was scary. So like between the price and just how it kind of felt at first, I was like, I can't do this anymore. I'm gonna stop, and I weaned off of it and was just like, I can't. I'll take a break. And then for the next couple years, it was just me not having medication, complaining about how much my ADHD got in the way of doing stuff and remembering things and being able to follow through on stuff and my girlfriend being very gentle and very kind, going, well, did you ask your therapist about meds again? Did you ask your therapist about meds again? Hey, could you please ask your therapist about meds again? And it's just like, oh, the patience of a saint. Thank you. I'm so sorry. And then about, let's say, like 5, 6 months ago, maybe a little bit longer, I was like, okay, I need to get back on them. and set up an appointment with a doctor to do another evaluation. And that doctor was like, yes, profoundly, you need this medication. Let's go ahead and get you started back up. So I started back up on Vyvanse again, which is now cheaper. But now I'm on the generic lisdexamfetamine version.
Hmm.
And it was just immediately like, holy crap, yeah, no, I need this.
Mhm.
So you can tell an immediate difference when you are on medication.
I definitely felt like an immediate difference with how I just like process things and behaved. Like I jokingly say to my girlfriend, like there's med days and no med days. And I'll tell her like, hey, today's going to be a no meds day. And she's like, I can already tell. Like I already know because the way your answer is lower, a little different, or you're just like, hey, what? I'm sorry. What's the thing? Hold on. I'm talking. Where'd you go? What's happening? Um,
Hmm.
yeah, it's a very much so noticeable difference in how I'm able to do things, how I'm able to go, yes, this thing that I just thought of, I'm going to follow through with doing it, even though
Hmm.
I don't care about and don't really want to do. Yes, I can go ahead and do all of the dishes and make sure the kitchen gets cleaned and make sure this gets vacuumed before I sit down and go, I'm going to investigate 19 different things on my phone and start
Hmm.
a project that I'm never going to touch and never do. And
Right.
yeah, it's clearly like, holy crap, this is something I need to be able to, for lack of a better term, exist in a world that was,
Ellie, what was you? I know you're on Vyvanse now, is that right?
Hmm.
Okay. What was your experience just with starting to take medication kind of to now?
Um, well, of course, also had some recreational use of the various ADHD meds here and there, but mostly it was while I was in college because my best friend had it and it was like, "Hey, we have a bunch of work to do. Do you want some help with the focusing?" I'm like, "Yes, that would be great." And then we would just work for, hours and hours, not occurring to me that maybe these meds work because you need them. Uh, smash cut to a decade or two later, and the thing I always talk about whenever people ask about medication because there is the stigma and they are worried it's going to change them or alter, their personality, whatever. And the main thing is that it makes things easier. Like you don't have to do quite so much effort to like white knuckle to get through like watching a TV show. Like time is no longer dragging at your brain and keeping you from like existing or doing anything that you actually want to do. Um, I of course have the autism and the ADHD, which means that no drugs work on me the way that they're supposed to, like ever, like at all. So I actually talked to my psych nurse last time. I'm like, is it a thing that people just like switch month to month between different ADHD meds? Because they seem to kind of wear off. And her answer was, no, we don't do that, and you shouldn't do that. That's bad for you. But yeah, no, definitely. It's executive function in a pill. Um, the apartment is cleaner, my desk is cleaner, my work is better. My work exists.
yeah,
Mhm.
it's wild how like things that used to be like, I want to rip my skin off while I'm doing this are things I can go, oh, I have to do this. So I'm doing it and it's done. And that didn't suck.
Hmm. See, it's so
Listeners, I
interesting.
just threw my hands in the air.
First of all, I apparently am the most boring out of all of us because I never took any form of ADHD medication like outside of a prescribed setting. But I think that's because I'm also like
Square.
I'm a chronic pain patient and I have to sign all of these contracts that basically say if you ever mess up or if you ever do a drug outside of what we give you, you're going to be in excruciating pain the rest of your life to pay for it. So that's fairly convincing. So yeah, so I had not ever taken anything like ADHD meds, and I was really hoping for this monumental shift for like everything to be easier. People talk about like going to the grocery store and going, "Oh my gosh, this is so much better." But I really couldn't tell a difference personally. Now, I could tell when Ellie would say, "Have you taken your ADHD meds today?" It was like, "Oh, okay." And so I started to recognize certain patterns of behavior, but that was more about like, if I do this, this, and this, Ellie's going to ask me if I took my ADHD meds. It wasn't
Hmm.
so much about how the meds made me feel themselves. And so I asked my prescriber, I said, is this normal? Like, does this mean that maybe they're not helping me? Maybe it's a, because I still thought they helped me because I did think I had more executive function on the days that I took it, but I was like, is this just a placebo effect or something? Because I can't feel this big shift. And the doctor said, not everybody feels that. So even though that's kind of the I'd say prevailing narrative among ADHD folks that I've encountered, it some people just don't get that change. But what matters ultimately is there a behavior change? And for me, even if I don't feel a difference, there is a difference in what I can accomplish for sure. So we know that it's working. But I started on Vyvanse and then I also abandoned Vyvanse because it was too expensive for a while.
Uh-huh.
But then I went to Adderall. And so I did Adderall, like short acting Adderall and long acting Adderall. My doctor was pretty hesitant to give me anything short acting because I think he just assumed that I wouldn't remember to take it more frequently.
Uh,
So, which is not wrong. It's
mhm.
a pretty good, it's a pretty good judgment. So now I've got it, and I'm back on the Vyvanse with the generic, and remember to take it in the morning. Is remembering to take your medication a problem for either one of you?
I mean, it has a couple times been like on days where I probably don't sleep too well or I'm like a little too busy in the morning. I'm just like, wait, did I take my pill? Is it too late for me to try and take one? If I take an extra one, will I die? And then it's like, okay, I'll just wait. I'll just wait like the 15, 20 minutes. And if I feel like kind of that kick from the Vyvanse or, then I'll be like, okay, no, I took it. But there have been a couple times where I was like, uh-oh, I didn't take it. And I'm just going to be kind of wonky today. And that's my work is just going to have to deal with that.
Mhm. Um, I spent long enough with like if you don't take your meds every day at the appropriate time, you're gonna die. So I've kind of forced myself to be better about that. And I've got the pill container, so it's like, well, did I take my pills this morning? Are they in the container? No. Okay, then they were in your face. Um, and Jess, I think it's pretty hilarious that you don't perceive a change in yourself when you take your meds,
I
but
don't.
I think you also just have really bad interoception,
I do.
which is well established. So like it's the yawning thing. When you're yawning a whole bunch means you're getting a migraine. You don't always notice you're yawning. I have to notice and be like, "Hey babe, poke poke. You're doing the thing." But it's definitely noticeable in me and you when we
There.
forget.
Well, I was going to ask about side effects. So do either one of you experience side effects from your medications, or have you experienced side effects on different doses of these medications?
Yeah, when I first started, because my first dosage was like 10 to 15 milligrams bigger than what I'm currently taking, there was definitely like sometimes like, oh, I can feel my heart in my whole body. And my jaw is noticeably a little more tight because I'm just like, I'm so excited to do everything. And it was like, maybe this is a bit much. This shouldn't be how I exist, and I can't exist like this every day, which is why like now with my doctor, every time I do an appointment, it's like, okay, what's your last couple like blood pressure measurings been? Like, has it been like staying down? I've been cutting out caffeine most of the time, like during the week, so I don't have like doubling up on the extra speed. I only take it for days when it's like, I have homework to do. I have to be, as I call it, zooted to the moon to really be going. for it. But yeah, like, and then there's like I when I was sick a couple of weeks ago, I went through a little bit of withdrawal, and that was adding on top of being sick and having body aches. I started feeling
Oh.
aches and having extra fever and irritability. So it was just like, oh, this is hell. This is the worst.
Oh. Well, I haven't had withdrawals, thank the maker. But I mean, we do live in a high desert, so there's like everything trying to dehydrate me.
Uh,
Luckily, I'm not on anti-androgens anymore because I yeeted them. Uh, but I can definitely tell if I get like dry mouth or like if we have to record a podcast, I have to be sure to be like, okay, do you have a Gatorade? And do you have a water? And do you have a tea? Like the required neurodivergent multiple drinks in front of you at all times thing. That was from back when I was like an early teenager and they first started suspecting this. I had a dentist who was like, okay, what meds are you on? And I was like, why does that matter? They said, well, the ADHD meds you're on, one of the ways that they work is it basically sucks moisture to your brain to make more neurotransmitters, and that can get pulled out of your mouth. And if your mouth is dry, it hurts your teeth. And
mm,
I have no idea if that's accurate or not, but I like the visual, so I'm sticking with it. Um,
we're sucking the spit out brain.
yeah, yeah. It's like the rest of me is just withering, and there's just a giant brain on top, kind of pulsing, like, you know. But yeah, no, not a ton as far as side effects, mostly just main effects, which is I can function as a human.
Mm.
Hmm.
Yeah, learned, I definitely learned the caffeine thing because the first time I had it, I think without thinking, I just popped my meds with a tea, and then proceeded to drink tea the rest of the day. And then it was like, this is not
Hmm.
pleasant. But the main side effect I have now is every so often, and I can't quite figure out why or when, because normally I take my meds, with food and, with something to drink. Sometimes I take it without, and most of the time it's fine. But every so often, it will make me like extra wired. So like my teeth will be chattering, and it's like, oh, I don't
Hmm.
think we can record right now because one, I can't control the speed at which I talk. And two, chattering teeth into a mic is a horrible sound. But it doesn't happen frequently. And it doesn't, I haven't yet figured out what makes it happen. I'm guessing it has to do with lack of sleep because I don't sleep well. And so I'm wondering if it happens on days when I've had less sleep or what, but it doesn't happen really frequently enough for me to track it. It's just happened, a few times. But I have found though, those days are really good. If I can sit down and get like hyper focused into something, then I'm really good, but it does make it hard to do anything but work because relaxing is not relaxing when you're just ugh. So, and
Hmm.
it does make it harder for me to remember to eat, which is problematic because
Hmm.
I have chronic migraines and one of my triggers is not eating. And so if I don't actually make it a point to eat, then it'll be 8 o'clock. I'll have a throbbing headache. It's like, oh, have I eaten anything today? If I haven't eaten anything, I probably haven't had any water either. So that is definitely something that I have to make sure to deal with when I take the medication. So that's a side effect I've experienced. Have either one of you, like, has it affected your appetite at all?
I wouldn't say like it's noticeable sometimes like the first month or so where you're like, oh, I'm gonna have to remember to eat because I'm on this medication and I know it's a side effect. But I would say before I had medication, I would legitimately just forget to eat. And, like that was one of the weird manifestations of my ADHD where it's just like I wouldn't realize until my body was screaming at me at like 7 p.m. like all you had was a cheese stick and like a monster. What is wrong with you? We are deprived of nutrients. I'm starving. And I'll be like, oh yeah, I haven't eaten yet today. And my girlfriend just be like, what is, how? How do you do that? You love food. And it's like, I do love food, but I just kind of forgot it was a thing I needed to do.
Mhm.
Hmm. Yeah. That was definitely a thing in the before times, and it's a thing now. But also the standard neurodivergent weird autoimmune thing that's definitely with my digestion. And so like not eating sometimes was like, I know if I eat today, I'm gonna feel worse for 3 hours.
God.
We'll just push that off till later.
Hmm.
Um, and now I try to make a point of like checking with everybody in the apartment, like, have you eaten today? Have you eaten something meal shaped? Okay, no, a bag of Doritos is not meal shaped. I will make you a baked potato. I'll be right back.
Yeah. I try to make it a point every day, eat something that was a plant at one point in its life cycle. Um, is my rule of thumb. But what's interesting for me is because I've had a history of disordered eating, which I don't know if either one of you knew was happening at the time, but you both have seen the results of that. Um, and it's funny because the times I looked, the times that I got the most compliments of my appearance were the times that I was the thinnest. And that was also the time that I was absolutely the least healthy because I was not eating anything on purpose. And then I'd go to what your show, Cameron, actually, the open mic, and it would be like, okay, I haven't had anything to eat today, so I can have this drink that has tequila in it and I can have cheese fries. Perfect. Um, or I'd go, okay, I haven't had anything to eat today, so I can have two drinks, which
Jeez.
is not the math that you want to do. Um, so but I have struggled a lot with binge eating, which is, eating to the it has nothing to do with hunger. It's basically, it feels like it's all on emotion. But it, I think there's a very high incidence of eating disorders with ADHD. And I think one of the reasons is because we already have this predilection for hyperfixation, and we're always searching for this dopamine hit and things like carbs, and those are great places to get dopamine. And so you're searching for this dopamine. I also have a chronic pain issue, which makes you look for the same kind of things. And you fixate on, at least this is how it manifested for me. I would fixate on something, like whatever it was, and it could be anything. People would say, "Oh, there's no if you only ate plain oatmeal, you would never binge on plain oatmeal." Oh, want to bet? You can binge on anything and eat to the point of like physical problems, like where you are in pain and can't stop eating because full isn't the point,
Yeah.
isn't the point at all. And so the reason that I've primarily gone to Vyvanse as my ADHD medicine is I think it's the only drug, at least it was when I started taking it. I don't know if it's still the only drug, but it is actually approved to treat binge eating disorder in addition to ADHD. So I have
Oh,
several clients that are on Vyvanse, but you have to be on a really high dose. Like I have to be on 70 milligrams, so which is pretty high. And that is something that I think as we learn more about ADHD and how it manifests in adults, because we still have a very child-centered knowledge base when it comes to how these things are, how they express themselves. We're going to learn more about ADHD and eating disorders because it just seems like a perfect storm of things that would make eating habits terrible for sure. Because even a lot of when I would yo-yo diet, I very rarely ever remember going, oh, I'm going to go on a diet now.
Mhm.
Usually it was like, oh, I forgot to eat for 3 days. Well, I might
Yeah.
as well keep this up, you know? And that's just sort of how it started. So I think there's a lot of tricky ways ADHD can make things much worse. So when people are thinking about medication or not medication, I think one of the best things that medicine can do for you is sort of even out some of your brain's worst impulses. So you self-sabotage less. You're less likely to do things that can cause major disruption in your life. Yeah, I think one of the things that I I try to be pretty measured when I talk to people, when I'm in front of a group, because I know I'm going to be talking to people who don't know anything about neurodiversity, people who are neurodivergent, people who don't know that they're neurodivergent, but also parents of neurodivergent children. And there's three times I kind of lose it. I'm slowly adding. I'm very exciting. I'm very animated speaker, but very effective. One of the things that I'm most challenged with are when parents say, my child is ADHD, but I'm not going to tell them
Mm.
because I don't want, and so by definition, most of those parents then are not going to get further support or medicate because obviously there'd be some questions there. Or again, parents who know that their children are ADHD, but don't want to give them medication. Usually, the thing I hear is because they don't want them to get addicted. And those are times that I really, really struggle to remain the professional that they are paying me to be. What do you either one of you think of that? I mean, it's or being late diagnosed.
Yeah, I would think it's like, I understand a hesitancy from some parents, like, I want to protect my child. I want them to not feel othered by this concept that they're having to take a medication because their brain is different, or, you know, make them feel like there's something quote unquote wrong with them. But I think that's a flawed approach of a parent not wanting to accept that their child is different in some way. I mean, like, I know of personal things in my own family's life before where, other than ADHD, where some sort of like mental illness or disorder or syndrome or something is considered like, oh no, people will look at us differently. People will look at my child differently. I don't want to accept that. I want to live in a world where my kid is quote unquote normal and they don't need these things. And they might feel shame for that. Like it's almost like their fault. Like, um, it's it's a bad decision coming from a place I think that they might feel like they're being, kind or good about. But at the end of the day, it's like you're putting your kid at a disadvantage if they really do need this help and they really will benefit from understanding themselves and understanding how to navigate the world and find the things that can put them on the footing that allows them to be I mean, for lack of a better term, the best version of themselves, or the most confident version of themselves, or finding a pathway that allows them to be able to do the things they want to do, and giving them a head start in childhood. Again, as someone who didn't know until their late 20s, like, that would give them such an advantage for the rest of their lives, knowing like, hey, this is something about my coding and my wiring that allows me to navigate the world, successfully, or with more ease, or more self confidence and understanding and awareness of myself, that, you won't end up beating yourself up because you're like, why can't I just sit down and study? Why can't I do this? Why can't I be like this person? Why am I always like this? Am I defective? Am I bad? And it's just like, it's such a disservice to a child. And I mean, it would hurt a relationship too. Like if you grew up and found out your parents hid something from you, like, I wouldn't trust you. Like, why wouldn't you tell me about myself? Why wouldn't you let me know that a doctor said I needed help and you said, no, I choose not to give you help because I don't like it? And it's like, there's so much study and understanding of ADHD now, more than there was 20 years ago, 30 years ago. And, there's more doctors willing to go, hey, maybe we don't have to put your kid on medication right away. Maybe we can find behavioral things. So, like, there's so many different pathways that parents can take. And I think it's just a general fear and stigma towards any sort of, diagnosis and othering of a child, that people are afraid, oh, my child's different. I don't want my child to be different. I want my child to fit in. I want my child to be normal. And it's this weird social normalcy that we cling to for all sorts of things that, you know, it's a natural fear. We're a social animal. We're a social creature. We want to fit in. We want to belong and survive. And that fear just it's nonsensical to me, especially as someone who has ADHD, and it just it comes from a good place, but it's silly. And I think if you want to love your kid and support your kid, the best thing to do is go, okay, let's try. And if it's not the right thing, at least we tried. And you can, talk to your child about it and have conversations about it and listen to them, as much as they are a kid, they know themselves. They're learning who they are in the world. You can trust your kid and how they feel and what they know, and really just give them this chance to learn to be an adult and learn to be themselves and express how they feel and navigate their own self-awareness. And that empowers a child. You allow a child to investigate and fail and make mistakes and learn and find new things to get through the world. You're empowering your child, and it's just a complete disservice as a parent to just go, no, I'm not doing this. I'm no. What are you trying to accomplish other than denying something?
Ellie, what do you think?
First off, that was beautiful and very articulate and well put, but I will disagree. I don't think it's coming from a good place. This is the kind of argument you seem to get from people who subscribe to right-wing ideology, and specifically the kind of billionaires who believe that universal health care is bad
Right.
because people who can't afford health care should die. So you get things like, you're going to go on this medication and then you'll need that every day for the rest of your life. Like, well, I also have to put on glasses every day for the rest of my life. How, what, like, oh, your kid has astigmatism and has a hard time focusing. They're focusing like their eyes.
Mhm.
So I'm not going to do anything about it. Well, they're going to turn 16 and they're going to try to drive and they're going to hit a building because they can't change the focus of their eyes quickly. In what way is that helping?
Yeah.
And if you live long enough, you will be on medication. We are all medical patients and we all deserve medical care. And eventually you're going to need something. I mean, even as if something as simple as glasses or contacts or laser, whatever. So it seems to come from this John Wayne, no weakness, no reliance on anything, he said while drinking municipal water, driving the speed limit, expecting everyone else to also drive on the right side of the road. Like, it's this toxic individualism.
Hmm.
And I mean, I've talked to people who are just like, no, I'm not gonna medicate. And I'm like, your life is falling down around you. You want to at least maybe try? Like, no, I don't believe in it. Okay. You,
Mhm.
I don't because I don't even know where you go from there. Like,
I
you have to try something.
Yeah.
I think there's still this inherent idea that anything related to ADHD is, I think at the end of the day, a lot of people really just think if we tried harder, we could
Hmm.
fix it, you know? And so, yeah, doctors say you have ADHD, but we all know if you can sit and play video games for 4 hours, you can study, which is, and what I think people don't realize is there is nothing, if you are playing video games for 4 hours and you need to study, there's nothing you want to do more than study. You don't want to be doing what you're doing either. It's horrible. And as much as anybody else punishes you or beats you up, you do it yourself much more.
Hmm.
And when you're a kid, to not have an understanding as to why, you know, people don't understand legitimately not being able to do something, not like being kind of a prisoner of your own mind. They go, you have free will. Well,
Hmm.
free will comes with a caveat, and that's with the chemicals in your brain allowing you to do the things that you want to do. So I think there's still in people's minds this idea that, well, really, these people are wrestling with something that everybody else does have figured out. They say they have ADHD. That's just code for being lazy or not, wanting to be an adult and figure out how to get places on time or to do. So I think a lot of the stigma around medication comes from the idea that this isn't really a thing that you would need medicine for because really it's if you were a better person, you would figure it out. So I think that's still fairly pervasive, unfortunately.
I would say it's also one of those things that's like you can take medicine for a visible disease and you can see you have the disease. So I can see, okay, you have a rash. I'll put the cream on the rash. Then the rash goes away. That's something people can see and it's easy. With ADHD, it's like, oh, you just have a disorganization problem and you don't do your homework. You're just a lazy. You're not, you know, you're not diseased. You're just choosing this.
Yeah. Have you bought a planner? I've bought every planner.
I
I
have
have,
1,000 notebooks full of 2 pages.
yeah,
Hmm.
yes. I could build a house, which
Mhm.
might be the only way we get a house is by building a house out of out of all the planners. This will be the last thing before we wrap up. Um, what non-stimulant, so either non-medication or non-stimulant medication, did you try, if any, um, in your, prior to taking medication? We'll do Cameron first and then Ellie.
I actually didn't try anything else. I was very worried about the altering of personality and the price. And for a while, before my current position, I was in and out of work, so I didn't have a lot of insurance. And the drive to get something for other like issues was just like, I don't know, I don't trust it. I think I'll be fine. Or I. It also came down to something like, well, I can just power through. All I've done my whole life is power through. I can do this. I just white knuckle it. I go through the process. I grit my teeth, and it sucks the whole time, but I deserve this and it's fine. And I've done it before. And it really took some stepping back through therapy just to go, actually, no, you don't have to do that. You could get help and that doesn't make you bad. You got help for addiction and that didn't make you bad. That made you better. That made you more aware and in tune with yourself. And you know, yeah, it takes time. It's not an overnight fix, but yeah, I never did any other medications because it was just like, no, this is fine. This is, and I think it goes back to being raised Roman Catholic, where it's like, no, this is what I deserved.
Hmm.
Ellie, what about you?
I was never all too worried about like changing personality or like affecting my mental state because I didn't really like either. Uh, like yeah, you know what? I could probably just I could have some corners knocked off. That'd be fine. Um, but yeah, no, nothing was terribly effective that I want to admit to on a recording. Um,
Yeah. I did try some non-stimulant medication just because being a pain patient already on controlled substances, adding another one, it's like, well, at some point in time, I'm gonna just have to visit the police station before I go get my medication just to be efficient. So I did try some non-stimulant medication. Guanfacine was the one that I tried in particular, and unfortunately, it is not something that worked for me. Um, I I am aware that it works for some people. I typically talk to more people where, they don't have luck with non-stimulant medication, but I do know some people that, that it has worked for them. So if you're concerned about stimulants, still just talk to your doctor because there are other options available. And there are people who choose not to medicate, because medication has worked for us. That doesn't mean, unfortunately, that it works for everybody. It can also be very difficult to find the drug and the dose that works for you, and that can be a very long process for people. Um, so, therapy, coaching, these are things that can be helpful as kind of like adjunct therapies or maybe, as a way to manage your ADHD in kind of a non-medicated environment. So, I know that that's a path that some people follow. Not advocating one way or the other for people, but we just wanted to share our experiences because, again, a lot of people have questions, and it's not necessarily something we take the time to talk about, really. So, yeah. So thank you very much, Ellie and Cameron, for sharing your thoughts. Um, Cameron, Where can people find you if they want to hear more from you?
You can follow me on Instagram at Callister Vision Services. You can follow me on Blue Sky. You can just search Cameron Little. I occasionally just retweet a bunch of leftist political and then occasionally go, "Hey, here's a joke." And also, I do a lot of like movie stuff on just I binge watch movies, so you can find me on Letterboxd as well at Callister Vision SE and see me bash terrible movies and talk about movies that are terrible that I love as well. So yeah, that's basically where you can find me, and I'll be getting back into comedy probably maybe in the near future. So you can find me at shows as well, and just message me and we'll chat. We talk about bad movies and it's fun.
Nice. And Jess, where can people find out more about you?
People can find me at coachjessicamichaels.com. You can set an appointment to have a free coaching consultation to find out if neurodiversity coaching or neurodiversity job or career coaching is right for you.
Well, that'll just about wrap it up for this episode of Gifted Kid and Messy Adult. If you like our show, please rate and review us. And for any other information, please email us your questions, comments, or just outright praise to giftedkidmessyadult@gmail.com. And so until next time, take care of each other out there.
Bye.